every time they blink. Hello and welcome back. I'm Dr. Elizabeth, board certified optometrist, and today we're going to be talking about the 7 risks that contact lens wearers need to know. My goal is to inform you so you can take your health into your own hands. I believe that preventative medicine is the best medicine. So I encourage you to learn more and understand about your eye health so that you know what to look out for and can seek help sooner rather than later. A lot of these diagnoses that I'm going to talk about can lead to more severe problems and in some cases, even permanent vision loss or blindness. So it's really important to know when to call your doctor. Let's get started. Contact lenses are a great way to correct vision for certain groups of people. They're really beneficial, especially for people who have high prescriptions, active lifestyles, professions where they may be bending or sweating. There's all sorts of reasons that people might like them, and maybe they just don't want to wear glasses. But the important thing to remember is that these are medical devices. So for your own health and safety, you should know how to use them properly. They should be treated with respect, or they can cause serious issues. It's really important that contact lens wearers know how to insert and remove lenses properly, how often to replace their lenses or their contact lens cases, and what solutions to use and how to use them. When misused, or even when contact lenses are used correctly, they can cause serious problems. So it's really important to know what to look out for. So without further ado, let's get talking about that. Today we're going to do a countdown. So let's start with number 7, ptosis. Number 7 is ptosis, which means a drooping of the eyelids. This is pretty rare, and it is much more common in people who wear the rigid contact lenses, not the soft, flexible ones most of us are familiar with. But it is a possibility, and it's hard to see it when it's happening because it happens kind of slowly over time. It's just an important thing to be aware of and to look out for, because it is unfortunately permanent. There's no treatment to this. The only thing that you can do is to stop wearing your contact lenses to prevent it from progressing further. Number 6 is contact lens keratopathy. This is redness and inflammation of the superior part of the cornea and the superior bulbar conjunctiva, which is this area here that's hidden by your eyelid. This may be due to hypersensitivity to the preservatives in contact lens solutions, and it may be resolved by changing contact lens brands, changing solution brands, and it can be treated with preservative-free artificial tears, steroids, and sometimes antibiotics are used along with the steroid. Number 5 is corneal neovascularization. This tends to be more of a problem with people who wear their contacts for an extended period of time, especially if they're not supposed to be worn like that. Like people who wear their contact lenses overnight, for example. Some lenses are approved for overnight wear, but most of them aren't. So it's really important to know if that's something that you can do or not. The people that tend to have the greatest problem with corneal neovascularization are people who don't go to see their doctor regularly. Some people might access their contact lenses illegally and not see their doctor for years, who knows? But if their contact lens is not one that allows enough oxygen transmissibility, the cornea is starved for oxygen and new blood vessels start to grow around the edge of the cornea. It's pretty normal to have a little bit right at the edge, but it can continue, and you can imagine that if it goes over the pupil, that's where your vision is, and that will affect your vision in a permanent way. So you can imagine people who don't see their doctor regularly, this happens slowly over time. They don't notice it until it starts to make their vision blurry when it's very severe, and that can become a huge problem. So regular eye exams, checkups per your doctor's recommendations based on your individual needs, that should help prevent this issue. If it has started, progression can be prevented by changing to a contact lens that has greater transmissibility of oxygen, or discontinuing contact lens where overall, sometimes even steroid eye drops are used. Number 4 is dry eye. Now, dry eye might not seem like that big of a deal, but as somebody who suffers from dry eye, it's incredibly uncomfortable and it affects you all day long because you're using your eyes all day long. So the best ways to prevent issues with dry eye is to make sure any signs or symptoms of dryness are treated prior to the initial contact lens fit. And sometimes even if people had normal healthy eyes before starting to wear contact lenses, they can still develop dry eye. This can be treated in numerous ways, but the reason is that contact lenses, especially the soft flexible ones, suck moisture away from the eye. Throughout the day, the lens that's on the eye begins to dry out. So it's going to steal moisture from the eye itself. You might think that putting a moist contact lens on will moisturize your eye, but that's not the case. That's one of the reasons daily contact lenses exist, and it helps with this significantly. And in some lenses, they do offer moisture to the eye, but for the most part, contact lenses can really dry your eyes out. For people that do struggle with dry eye, these daily replacement contact lenses can be helpful, and actually some contact lenses can actually treat dry eye. These would be those scleral lenses. They're rigid contact lenses, and they're quite large, and they're actually filled with a solution before they're placed on the eye, and that solution remains in that area the whole day. So it actually offers moisture to the eye. But generally speaking, contact lenses do cause dryness. Some people may not be candidates for contact lenses simply because of dry eye. Number 3 is giant papillary conjunctivitis. The conjunctiva is the clear tissue that covers the white part of the eye as well as the inside of the eyelids. In giant papillary conjunctivitis, the inside of the upper lid becomes bumpy because of inflammation caused by this mechanical rubbing along the top part of the contact lens, which would rest about here. These bumps on the inner eyelid cause so much irritation, discomfort, mucus discharge. It's a very uncomfortable condition, and it requires a contact lens vacation. Sometimes people can't wear their contact lenses for months as they're treated with various eye drops. The problem with this one is that a lot of people think that their contact lens is helping with the condition because they're mostly irritated after they remove their contact lens. So they think the contact lens is fixing the problem. But actually, the contact lens is acting as a protective barrier between this bumpy eyelid and the cornea. Then at the end of the day, when they take off their contact, every time they blink, those bumps rub on the cornea and it's so uncomfortable. So they just want to be wearing their contact lenses, but that just makes the problem even worse. So it's really important to get this one diagnosed. Your doctor is going to have to flip your eyelid inside out to check for it. But believe me, it's not as creepy as you think. And if this is diagnosed and treated properly, it can save you a lot of trouble in the long run. Number 2 is corneal abrasions. Corneal abrasions with contact lens wear can happen for a couple of different reasons. One could simply be poor insertion and removal techniques. Back when you originally see your doctor to get fit with contact lenses, they'll train you on how to do this, but a lot of people get lazy or complacent over time, or they just do what they think is easiest or best, but they're not always right. How people are taught to remove their contact lenses are to put their finger on it, drag it down away from the cornea, that front clear part of the eye, and then once it comes off of there, it already starts to buckle because it fits best just like this. When you drag it down, you can pinch along the bottom of the lens and remove it. But some people pinch it directly off of the cornea, and you can see how their finger, their thumb, might rub against the cornea as they pinch it off. And over time, this can cause abrasions, irritation, can even lead to infections. There are also situations where people might wear their contact lenses overnight when they're not supposed to. As you sleep, your eyes dry out. And when you wake up in the morning and remove that contact lens, it can be kind of dried against the cornea, and some of the cornea may come with it. You definitely don't want to do that. We are nearing the end of our countdown, so before we get to the number 1 risk of contact lens wear, let's go over some honorable mentions. These would be contact lens deposits, corneal warpage, tight lens syndrome, a torn contact lens, reduced blink reflex, and displaced contact lens, meaning it goes up underneath your upper eyelid and you can't quite find it. Don't worry, everything is closed up back there. It's not gonna make it all the way back to your brain, but it does need to be removed. And your doctor can do this for you. I think the number 1 risk of contact lens wear is infectious corneal infiltrates or ulcers, also known as keratitis. This can be due to numerous causes, whether it's bacterial, viral, fungal, or something called acanthamoeba, which unfortunately works very fast, usually within 24 hours, to cause a blind eye. If you have a corneal infection like this, it tends to cause severe pain, so you'll know that something is wrong. This isn't a "I'll wait till I get back from vacation" situation, or "I'll wait till I'm done with this big project" situation. This needs to be treated immediately, or you can have vision loss that's permanent very quickly. Sometimes people may not have as much pain as you'd expect, and that's because contact lens wearers tend to have reduced corneal sensitivity. So if something seems off, or if you've taken your contact lens out, checked it for tears, made sure it was right side out, maybe even tried a new lens to make sure that one wasn't defective, and you're still having pain, you need to call your doctor right away. A number of the conditions that we talked about can cause corneal scarring or even blindness. There are certain symptoms that you should look out for, especially as a contact lens wearer, that should be big red flags. And that would be pain, redness, light sensitivity, itching, discharge, decrease in vision, especially if it's sudden, burning, or contact lens intolerance, or even, like we talked about earlier, irritation after you remove your contact lenses. So if you wear contact lenses, remember these things and learn how to take care of your contact lenses properly. If you're not sure how often you should be replacing your lenses, or what solutions you should use, or how often you should replace your contact lens case, if you have really any questions, you should call your doctor. They're going to appreciate that you're taking your health into your own hands and that you're not putting yourself at risk. They'd always rather treat you when you have a mild condition versus one that is severe and vision threatening. So don't hesitate to call. Help out a friend who wears contact lenses by sending them this video. Survey says that 45 million Americans wear contact lenses, and all of them should know these risks. Thank you so much for watching, and I hope to see you in the next one.